That's me.
So, yeah, that's
No, who's the next one that also has a similar phone situation, beginning with 19,
Oh,
but ending in 98?
I don't know, but my name's Tony Lopi, and I'm representing the Spring Hill area, but my family's
Okay.
from Lucas.
All right. So you're representing Spring Hill, though?
Yes.
Okay. Wonderful. And the next one, Gina. You want to just introduce yourself and say which community you're representing, please? Gina, I think you're muted.
Can you hear
There
me
you
now?
go. Got you now.
Yeah, I'm in Toronto, so this phone is not quite connecting right. I'm representing Upper Hammer Plains, and my
Wonderful.
name is Gina Jones Wilson.
Yes. Thank you, Gina. Next up is Pamela Appling.
Hello, everybody.
Oh, Pamela.
I'm representing East Preston.
Wonderful. Glad to have you aboard, Pamela.
Thank you.
And Praise, you're up now.
Hi everyone, my name is Praise and I'm representing the Congolese community.
That's wonderful. The Somali Relief Network. Would you
Yes.
identify your name too, please?
Hi, everyone. This is Becca Jama with you, and I'm representing the Somali-speaking community here. Thank you.
All right. This is awesome. Okay, I think that's everyone. We've got everyone. Paula, we got you, right?
Indeed. Yeah, no, my turn.
Oh,
Paula.
okay. Very sorry, Paula.
Don't forget Beachville.
Beachville. Oh, can't forget Beachville,
Again.
never.
Yeah. So I'm Paula Blackmore, and I'm the community facilitator for Beachville.
All right.
Hello.
Don't worry. I won't forget you
Don't
ever
forget us.
again in
All
life.
right then.
Okay. So as I said earlier, Adekoke will be presenting the ABSW HAAC COVID Initiative slideshow. So take it away, Adekoke.
Hello, good afternoon, everyone. Like I did say, my name is Adigoke. I work with CCFV. On this project, I'm the coordinator for communications and marketing, and I'm glad to be here. So first of all, I just want to confirm that everybody could hear me clearly. Two, also that the slides are visible and that everyone can see the slides. Is that the case?
Yes.
Okay, I think it is. It's nice seeing you, Gina Jones Wilson. I know that we had some communication with, the timing and all of that. Thank you for being able to join in because I thought you were coming in using your phone, but you were able to join in through your system. That's fantastic. Okay, so let's talk a bit about this project. So this project requires us to carry out a survey, and it's important that we do this because we do have to hear the voices of our communities, and it's important for those voices to be heard. And that's why this survey is very, very important because when our voices are not heard, then we cannot be adequately represented. So I just want every community facilitator to recognize that you are literally helping the voice of your community that you represent to be heard. And if they are not heard, there's no way that policies can be developed to be able to affect it. So for this survey, in order for community facilitators to be able to partake in this survey, they have to go through, I think, 3 trainings. It might be 4 at the end of the day, but I think 3 primary trainings. The first one, I think it's the how to do a survey. And the second is this ABSW ACT. And then the third one is something about Ed Promoter. It's important. So if you haven't made all the 3 yet, that means you're probably still going to get a mail requiring to meet whatever that training that you're missing for you to be able to attend, please, I would like you to try and make out time to be a part of it so that we can hear the voice of the community that you're representing. So there won't be much further delay. We're hoping that this can kick off as early as next week, Monday. Without that being said, let's go into our slides. I don't work for ABSW, so please pardon me. It's going to be a short one. This is not going to be a long. But it's just important for us to have an idea. ABSW and HAAC are part of the partners for this project. And this COVID-19 initiative is part of the things that they've been championing. And so as a result, we want every community facilitator to have an idea, what does it mean, what do they do, and things like that. So just in case while they're out there in the field, they have questions or people need to get references or directions, you'll be able to see how you could direct them appropriately. So we'll be looking at this slide. We're going to be talking who we are. In this case, I might be speaking in third person at times because like I said earlier, I don't work with ABSW, but I'm doing this. So we're going to be looking at who they are, what kind of work they do, and what is next. So what does ABSW mean? It simply is the Association of Black Social Workers. It's primarily situated here in Nova Scotia, and it's as a result of it was established in 1979. And there are 4 major founding members, one of which a lot of us might know is the Senator or Dr. Bernard. She's one of the key founding members of ABSW. It came as a result of the African Nova Scotian needs not being represented or being met. We still have those cases and those scenarios or situations at the moment. And that's why it's important that things like what we're about to do, the survey, we're not trying to coerce people to give us a particular response, but we're more interested in being able to hear their voices. And that's why one of the things we'll be doing with this on our own side is create a website which we've called Black Health Affairs, which basically is the voice of the Black communities. We want to be able to feel the impulse, feel the pulse of the community, and be able to push it out there so that the relevant authorities can be aware and they can find ways to be able to address it. So ABSW came as a result of one of such needs where the Blacks were not represented. And the truth of the matter is that when you're not represented at the table, there's no way your interests can be covered. And as a result, the African Nova Scotia interest wasn't covered. And that's why ABWS decided to be formed so that they can meet up and cover that gap. I know for most of us, our impression is that it generally is more of a social service worker. It's not just about social work, it also deals with social service workers. What does that mean? It means that everyone who works with people or persons are also able to be part of this network, and this is important. And another thing that we want to note in terms of the journey of the history, it was until 2021 that we started getting core funding from this year's Assembly, the Department of Child Service and Support. So let's quickly look at what the objectives are. So there are 3 major objectives, and I just want to quickly talk about them. One is to provide education by providing courses, seminars, workshops about social work-related projects, programs geared towards persons of African descent. I need to pause to try and explain the importance of this. I know there are some people who think that ignorance is bliss, but being ignorant about a thing robs us of the opportunity or the power to be able to get the best benefit from a thing. So what ABSW has done is to provide courses, seminars, workshops, about social work related projects. I know that when a lot of us hear about social work, we sometimes think that, oh, they're here to take away our kids or they're here to break away our families. And the truth of the matter is the experiences that you have, the culture that you possess, it forms us in a certain way that is different from the larger society. We, because of the kind of experience and exposure or the history that we've had, especially the history, dating back hundreds of years, they've shaped us, they've given us a certain mindset or orientation or a view about life that nobody else can better appreciate or understand. And that's why it's important for us to have representatives at the table so that they can speak our language, they can speak our thoughts, they can be able to share the experiences and the mentalities that we have with with the larger society, so that when policies are being made, they are not made to serve as a deterrent for us, but they help to serve as catalysts. So that's one of the objectives. They provide courses and seminars. Second thing also is not just do they provide this, they also empower. So they advance education by providing scholarships and bursaries and awards and other forms of financial assistance to persons of African descent enrolled in a social degree program. And the reason why I state this is because I'm restating it is because I want us as Blacks and as Africans to push this message to our community, to get our people also involved in social work so that we can have more representation there. And their scholarships and their bursaries and their awards and their forms of financial assistance that are possible as long as they are in those kind of social degree program. So in our engagement with, as you know, as just being community facilitators out there, it's important for us to try and spread this message of people should be more and more involved in social work, because we can deal better with our cases than somebody else can deal with our cases. I think it's important. And then we sum all of this up to do all such other things that are incidental and auxiliary to the attainment of this foregoing objective. So our job is to ensure that these two objectives, so if it requires us to think outside of the box, like COVID-19 has, COVID-19 is something that caused everybody to think out of the box, is we ensure that we come up with ways and ideas to ensure that those two key objectives, which is providing a platform for learning and also empowering people. So it removes the excuses for the reason that, the reason why I cannot do this because I don't have this. So we also empower people in order to do that. I also want to say at any point in time, you can interrupt if you have a comment, a question, or a clarification. It's important because this is it's just a conversation between you and I. So these are the present executive members. They presently sit on the executive team that make a lot of the executive decisions for the association, and that's okay. So let's talk a bit about the membership. Although the slide needs to be updated, the active members are about 45, if I'm correct. And those active members are people who cut across not just our social workers, like I said, but people who are into social services. So they do not just represent just social workers. People who are also involved in social services are also involved. We also have people who have joined us from Ontario, Newfoundland, and British Columbia. Yes, the association is more for Nova Scotia, but because there's nothing like this anywhere else in Canada, and I think we should be excited about blazing trails. So we've had people who have come, who have engaged ABSW, and as a result wanted to be some type of a member, just so that they can learn and glean from the experiences to be able to transport and export to other areas. We also have, as a result, 70 individuals who are what we call correspondents. So they constantly engaging us. They are not full members in being able to learn from what we do here in Nova Scotia and being able to take it also in different places. So we're also interdisciplinary, which also means that we speak on different platforms. We represent different areas. We represent health. So that means it's not just all about social work in health, in justice, even in the school board. Like I said, the whole aim is to be able to ensure that our mindset, our representation is expressed in those various areas, in justice, in the school board, is represented in even the social justice itself and the likes. And like I said, we also represent social workers and social service workers. There are a couple of things that we do that ABSW does. So they have what we call the services and supports. One of such is community engagement. Our community engagement cuts across different things. We do community engagement with seniors. We also help with case management. So if, for example, there's an incident that requires us to, I know that for charitable organizations, they don't like the word advocacy. You see advocacy, Canada Revenue doesn't like it, but we do a lot of advocacy too. So when there are incidences, case management, whether it's health related, injustice or education or even in employment. So sometimes we show up at employers' places trying to see how we could create better diversity in those places and all of that. So those are some of the community engagements that we do regarding employment, also in service contracts and advocacies. We haven't done the summer camp this year. We didn't do it this year, but hopefully we'll be back. So we have something called the summer camps, where we were able to organize, Black kids to be able to come together in summer camps and to expose them to skill sets that are vital and important that help them in their everyday life. We also have something called Search, which helps people with white families with Black kids and being able to help them navigate the roads those Black kids will go through, because we do know that they will have encounters with racism and things like that. So we also help navigate those processes and those areas, and we do a lot of youth engagement also, because like I said earlier, it's our joy to see many more in the youth get into such programs, into and to see how they can be social workers or social services providers, so that we can have more representation. Because if you don't have people at the table, or at the end of the day, it's all for nothing. So other services that we do what we call community representations. Obviously, we know about the Black Lives Matter movement that happened. As a result of that, government realized that they needed to have Blacks in many of those various committees that they're setting up. And as a result of that, a lot of engagement was, a lot of, they approached ABSW. And so as a result, that ABSW sits on many committees right now, and trying to advise and trying to bring about the Black and the African issues to the fore, so that our issues are not ignored or they're not overlooked. And they do a lot of community representations for that. Those are some of the things that they do. They also engage in what we call community projects. They have something presently with Nova Scotia Community Alliance, that's prevention of age. And it's an amazing thing they've been doing for about, it's been going on for a couple of years now, because these are some of the issues that we face as Africans, and they've been involved in those projects. They also have what we call creative communities of care, that support for survivors of domestic violence who are from underserved communities. I know that there are a couple of these. I know one of such they did was domestic violence they did with the diaspora, the African diaspora, also, as I think about 2 or 3 years ago, to help with all this domestic violence and being able to create a support system around them, because we go through some of this violence, and they're also there they have those projects. Another thing, they also help with foster care redesign. Obviously, we know that heavily right now, a lot of the foster care system has been more favored to the general populace, if you understand what I mean. I'm talking about the wide populace, and so it's important for us to have a redesign, because our culture, our value systems. And so they are presently working on that project on recruitment and retention of Black foster parents, hoping that more and more Black parents would begin to adopt. So they're working on those redesigns, and those are some of the things that they do regarding project-wise. They also have what we call the educational sessions, like the anti-Black racism. Obviously, trying to call, because sometimes in life, when you have racism, you don't even know. We call it conscious biases, you have no idea. So they create a lot of symposium, a lot of sessions, training employers and training even people within the government, parastatals and various institutes of government about anti-Black racism, calling for what we might have taken cognizant or we might have overlooked before. They have allyship with their different people who are in the who are white, who want to be able to partner and be able to understand what is how those alliances can be formed, and because we matter movement also. Because sometimes you go to some employments and you see that the deployable conditions, that some Blacks are going through, and so they have that initiative where because we matter, so that we're not just a figure or just a writing, but we're also we're a person, and that we matter. And those are some of the educational sessions they have, that because we matter is more centered towards employers and things like that. Is anybody getting anything? Because I feel like, because I can't even see your faces, I've just been looking at the slides since, but I guess somebody's getting something, hopefully. So another set of stuff we do is we do professional development. We talked a bit about that earlier on, because we try to, at ABWS, they're trying to remove the excuses out of the way. So they do student bursaries. And, we talked about Dr. Bernard. She's one of those bosses. Okay, I guess somebody, hello, somebody say something?
Oh, sorry.
Okay, you just wanted me to know I was not alone.
Yeah, no worries. I was just clearing my throat. Apologies. I didn't realize I had that.
No problem. So they have member support, African-centric workshops, fighting for change books, and they also have conferences. They majorly have a conference, I think, at once in 3 years or so. I think the next one is in 2 years from now. But those are some of the things they do. Those conferences serve as an opportunity for also attract large number of persons within far and near, and for us to be able to discuss some of the issues and be able to see how we can bring about policy changes. Okay, so I've spoken about ABSW. I want to talk a bit about ACT for a few seconds to just talk about what they're about. One of the key things I want to start by saying about ACT is the fact that is the slogan, "Our health is our wealth." You've heard that it's been said that many people chase wealth with their health, and after they get the wealth, they lose their health. But it's important for us to underscore that in all that we do in our endeavors, our running up and down, and our deadlines, that we remember that our health is our wealth. And that's one of the major push, a major drive of ACT to echo that to us as Blacks, because we many a times are disadvantaged on many fronts. We're disadvantaged because of the experiences we've had. We're disadvantaged because of things that have happened, because of some opportunities that were excluded from us. But while we begin to recover ground, we need to remember that our health is our wealth. That means that no matter amount of wealth you have, if you lose your health, you've literally lost everything. So it's important to always remember that. I'm just going to talk a bit about the history of ACT. It was established in 2000. Obviously, ACT is simply the Association of African, let me just go back there. So it's the Health Association of African Canadians. It's primarily representing African Canadians who are within the health sector, and I think it's a very good thing to be able to have our own umbrella, to be able to talk and be able to converge as African health professionals. So everyone who is working within the health profession, is important for you to be part of this. So it was established in 2000, and at that time there were only 20 membership. And in the last 22 years, it has grown tremendously from 20 to 120 as of this year. They've had all kinds of initiatives like Better Futures, Diabetes and Health, Matters of Black Health Coaches, and they do have some ongoing initiatives like Research Partnership, Health Data Leadership, Policy Development, Initiating Black Health Infrastructure, and numerous projects. It's important to talk about this past initiative because for us as Africans, one of the things that we face a lot, at least indices indicate, is things like diabetics. And it's important that those initiatives are kept in the fore and things like that. So those are some of the initiatives that they do. And I would encourage us, as different communities, to see how we can engage ACT in ensuring that some of those initiatives are brought to our community. As community facilitators, there are many things you are the voice of your people in a lot of extent to be able to champion. This is one of the snap pictures of one of such trainings during the COVID era, because everybody had to go online, and those are some of the people. The lady here in white is she's the, should I say, the immediate past president, and that's Dr. David, and the guy on the extreme left on the top with the smiley face is the treasurer for ACT at this time. Okay. So what is the vision and the mission of ACT? So it's for striving healthy African Canadian communities in Nova Scotia. So striving, so we're looking for a community that is striving, that is active, that is alive, energetic, also healthy African Canadian communities. So that's what we're all about in ACT. So to promote and improve the health of African Canadians in Nova Scotia through community engagement, through education, policy recommendation, partnerships, and research participation. So that's how we go about the mission. So the vision is our endpoint, where we see where we want the African Canadian communities to be like, and the mission is the bridge in getting us to that place. So we believe that if we promote and improve our healthcare through engagement, education, policy recommendation, partnership, and research participation, that we will end up having a thriving a healthy African Canadian community. And this survey we're about to do is one of such, because it's a research participation that is going to help us be able to come out with the voice of our people. So for example, we'll be able to have an idea of those who have maybe, for example, issues with vaccine, COVID vaccine, and we'll be able to hear from them why or what those issues are. So we're not going to tailor-made those questions. We're just going to have an engagement, a conversation. So for those who are for it, why are you for it? What exactly is it about it that you are for? So that it helps begin to shape the thoughts within our community that we can be able to transmit, and then things like how you get your information about vaccine. So we know where those sources are and things like that. And so we can engage well, adequately in future also. Okay, so these are the present HAAC executive and board. I won't talk much about it, but they're a very diverse board. You can see people who are newcomers or immigrants, people who have been here, the historical Black communities, and all of that. They're represented on this board. Is a broad spectrum, and I think that's fantastic. So just going to look at some of the current projects and initiatives that we have right now. Obviously, the key thing that we're talking about is the ABSW / HAAC COVID-19 Response and Impact Initiative. I want to say there's hardly any project that HAAC does not have something to do with their sister partner, which is ABSW. So they've had an ongoing relation over the years. And so this project is all about COVID initiative, and they were the fourth burner of this initiative regarding COVID-19 response and impact, because when the COVID-19 hit, there was no cultural response. There was no voice from the historical the Blacks or the African diaspora to speak on that matter. So initial stuff was squid wrongly, but because of their initiative, response and impact, if you look at some of those details, they were able to help with the narratives. They were able to lead some of those projects, were able to lead some of those initiatives that led to some of the new modifications that we saw in the process of when largely when the COVID period was really on. So, but these are some of the initiatives that are ongoing presently. We have the present president of HAAC, the co-chair of HAAC. She sits on the board of the Dartmouth General Hospital Health and Research, which is funded by TD Bank. And these are some of the projects that and they're doing. But just because of time, I'm not going to be highlighting on all of that stuff. But most of these projects are ongoing, and we're really proud of what HAAC is doing, and I hope somebody here is also. Okay. So like I did talk about having conferences and stuff. On the right was one of those African Nova Scotia COVID-19 impact that the town hall they had. There was obviously a case of when they wanted to start vaccine with the children, and there was a lot of misinformation or lack of information, as the case might be. So they came up with a seminar that was November the 23rd, and which brought panelists. They still work a lot with Dr. Ryan, brought different panelists to sit on it, to have a community engagement. It was really very productive. And they do have another one coming up. So you could save the date to be part of it. It's happening on October 6th to the 8th of 2022. It's going to be at Halifax Marriott Airport Front. It's tied to the International Black Health Conference. I think it's something that us as community facilitators can be a part of. I would like us to get involved so that we know what's happening, and we can also contribute our voices to those conversations, and so that we can have a much healthy African Nova Scotia community. So that's going to be on October the 6th to 8th. It's important for us to state it, and I'm hoping to find many of us be part of it, and also look out for more information about it also. So we're going to quickly talk about the various COVID-19 initiative, because like I said, they jumped right on it in the midst of the chaos that was taking place all over the world, and also right here at home. And they came up with COVID-19 initiative. And some of those initiatives were some of those things that helped us through what we call the dark and the trying times. And those initiatives are still present, and they're still available. and it's nice for us to know what some of them are. So obviously this was the initiative overview. So they started out by creating a joint initiative that commenced April of 2020. We know that by March, everybody was literally on lockdown. So you can see how quickly they were able to jump on this to come up with something that, could be representative of us as African Nova Scotians. The initiative went from a response to an impact, then to a vaccine, because those are the three major stages. Initially, they needed to create some type of response for us. Then they created an impact and phase, and then there was the vaccine phase. And when it started initially, it was all about HRM, and we know how that always seems to play out sometimes. But with time, it became a provincial scope. They recognized that this is not just something that's just HRM. This is something that has to be provincial, and then it became provincial wide. And then there were the team members who were vital, and so we began to get people from different places, from ANSA, to get involved with it, and then the team used to meet weekly, but now they meet monthly. Like I said, that whole process is still up and running, is still available. During when the toll-free number ended, they had received over 2,000 calls, because a lot of people who were a bit confused, we needed clarification, we needed understanding. This is what HAAC and ABWS represent for us, and it's good for our community to know that they exist, and it's good for our community to be able to see how they can take advantage of that. So this is what they call the response/impact team. So obviously Veronica and Sharon. Veronica is now the past co-chair or chair of ABSW, and Sharon is the one for HAAC. And so they created a toll line, and then they got different representatives. So we had what we call the HAAC coordinators. We were people like Dr. David Ace. We had the health coordinator. We had the AUBA coordinator, which obviously because as Africans, we're also very spiritual. So we had the spiritual aspect of it. We had people from the school board, educational aspect, because when COVID affected all facets of our lives. It affected even our ability to go to church for some of us. It affected our ability for our kids to go to school. So we needed to draw up a broad-based representation. So this was the representation that existed which was known as the response and impact. He had the answer coordinator, who was Tracy Thomas. He had some from Department of Child coordinator. Then you have what we call the community intermediators, because we also had what we call community coordinators for each and every community possible at that time. So this is how it looks in terms of a graph of those various people that made up that impact session. And so this is my screen is not very clear on the names of various community coordinators, but I'm sure maybe if you look at the slides that I sent, probably a bit clear. Some of those names have changed. Some of them are no longer community coordinators. They've moved on and all of that stuff. Like I know for North Preston, the community coordinator, they had to move on. So this is the community coordinators that we had at that point in time. The list has changed. We will definitely get you more updated list. So this was supposed to be people who literally can help reach those various communities, and that's one of the templates that we've created. So in the response phase, we created a toll-free line that was established. We did stuff like sanitation supplies, because there were people who couldn't go out, people who were terrified of going out, because we also know that the Black community is one of those that were heavily hit. They provided food boxes, medical supplies, so hand sanitizers and things like masks and things that were provided. They had town hall sessions, stay-at-home provisions like gardening, so that we still stayed active and healthy, even though we were still at home. So some stay-at-home provisions were also provided. These are some of those pictures. Some blood pressure monitors for people to be able to measure their blood and things like that. So on the impact stage, we went to what we call the mental health counseling, the spiritual counseling. Like I said, it was a tough time for us as Black community, because I remember when only 5 persons was allowed to attend funerals. And us as African, your brother is not just the one from your family. Your brother is, everybody else within the community. And so people were going through the tough time. They couldn't understand why was this happening? Why are we experiencing COVID? Why is it that my loved one was had to die and things like that? So it was a need for a lot of counseling. So there's a lot of spiritual counseling, And there was also grief sessions because people lost loved ones. And the worst part of it was they couldn't even have a closure because they couldn't even attend the burial. They couldn't show up at the funeral services and things like that. So there was yoga and meditation sessions, and there were culturally specific health information that related to us as African Nova Scotians. We also did some town hall information sessions. So those were some of the things we did during the impact phase. And then when it came to the vaccine stage, we created 17 clinics, which were provincial, which were primarily for Blacks or people who were white, who were either married to a Black person. Obviously, their family and that they were also welcome. We also had town halls. We also ensured that there were people who could not even afford to be able to come, that there was some type of transportation to bring them to those clinics. There was involvement of the community. So a lot of where do we situate those clinics, for example, we couldn't tell for certain. So there were a lot of engagements with the community facilitators on ground to help with setting up, as in locating appropriate areas for those clinics so they can be close to the members within the community. And like I said, all those phrases are ongoing, and support from health and newsletters and research. And we know that when we had this training a while back, some weeks ago, there were some people who said they didn't get those newsletters, but I know that a lot of money was spent on pushing out newsletters through the community facilitators to those communities. I don't know, maybe that might even be the case now. Maybe some individuals here tonight might not even have gotten access to some of those newsletters, but there was a lot of money that was spent on printing those newsletters and getting them across. So this is the benefit as I begin to round up. One of the benefits that this COVID-19 initiative has done, it has given us a template, an holistic model that in case if there's any other type of outbreak tomorrow, there's a template to follow. And the template is pretty simple, which is having community representatives, at different communities that can become the voice, the hand, and the representation of government, even in those areas as quickly as possible to the African Nova Scotian community. So it's a template that has been adopted, it's a template that has been accepted, and it's a template going forward for any kind of future emergencies that might arise. We're not asking for it to arise, but we have a template for future provincial emergencies, whatever the case might be. Also, we also enjoy support from all levels of government, both federals was throwing in money, provincial and municipality also. We enjoyed all kinds of support, and obviously communities working hard to, so we also have what we call community facilitators that we can easily engage and be able to have interactions with, if ever. So we have a template, and I think that's one of the what you call the blessings of sometimes when you go to the dark moment, you are able to come out and formulate something that makes you stronger and better for future occurrences. And I think that we are better off right now, for any kind of emergencies that might arise for the African community in future. We got a lot of funding from African Nova Scotian Affairs, Department of Community Services, United Way. These are a couple of people who have supported and funded us during this COVID-19 initiative. So where are we now? So we still have an ongoing collaboration with Nova Scotia Health and Department of Health and Wellness. We're on impact and messaging, to the African Nova Scotia community, and then the work with this IPHEalth project that we're working on. So I'll just quickly say the tireless work of ABSW and our COVID-19 initiative is not finished. Working to encourage communities to get vaccinated and to take precaution against the pandemic. Recent removal of public health measures requires a different approach. We're supported by Mobile Public Health Unit. The initiative is offering pop-up clinics in different communities. We're also advocating for providing vaccines at different community events, because we know there are a lot of community events that we always do. So those are some of the things that we're still doing. We also keep advocating for a system-wide policy changes that increases in representation at decision-making levels. And I know this is one of our concerns. One of our concerns is to ensure that the data that are gathered from us as African Nova Scotians, that we're able to be at the table to interpret those data, so that those data are not interpreted for us, but we are also interpreted with inclusion of us. So as members of ACT, always we say nothing about us without us. So those for us are very important. And I would just say Thank you. Thank you. I hope I didn't take too much of your time, and I hope I've been able to create a framework of where we are today regarding this initiative. And as we begin to, go out into the community to engage our people in this survey, that we're able to let them know that there is a voice that wants to represent, that represents them in different communities, that there are people that are championing the matter of African Nova Scotians, and that I think is important. So at this junction, I'll pause, and I would say we can have a bit of conversation, and if there are questions, remarks, we're here. Thank you very much. I hope you had a great one. You're on mute.
Thank you.
Dennis, you're on mute.
There we are.
Okay, cool. Mhm.
Thank you so much, Adekoke. That was a great presentation. I really appreciated it. Do we have time for a questions and answers session with our participants? Sure we do. Yes? So does anyone have any questions for Adekoke? Any comments?
I found it very informative. I didn't know a lot of that. I wasn't aware of all the stuff that was going on behind the scenes. So thank you.
Yes.
Thank you so much for that.
Adekoke, the toll-free number, is that, do you have that on the slide?
Yes, but I'm not sure
I
that
just couldn't see it.
I'm
The
not
font
sure.
was so
I'm not
small.
sure. I'm not sure that still works.
Oh, okay.
Yeah.
But
Yeah, the number's
anyways,
on here. It's 1-855-732-1253.
253.
I was wondering if it was still active as well.
No, I don't think it is anymore.
oh,
I don't think it is.
Okay. Thank you.
I thought that Veronica had mentioned to me they had received funding a couple months ago, and I think that they had the toll-free line reactivated. I don't know if it's the same telephone number or not.
yeah.
So we can definitely find out, and then we can always get across back to you.
Yes.
That's not going to be a problem. We'll double check. But we know at some point in time it wasn't, but I don't know if
Yes.
it's back on right now.
Yeah. And I'd just like to say, on Thursday, there will be another session by the United African Canadian Women's Association at 1 o'clock, and Adekoke will be sending you an invite for that session.
Maybe just a quick question, but for the International Black Health Conference that's happening, as you said, from October 6th to 8th at the Marriott, does it require tickets? Is it like, can you just provide for the attendance for anybody who wants to participate in that?
I think there's a registration.
Oh, okay.
For that, there is a cost, but they're also providing funding so that people can waive the cost to attend for the registration fee. There is a registration fee.
Okay. Thank you. Yeah.
You're welcome. But if you're interested, please let us know and we'll pass that information on to them so that they can provide you with the link to waive the fee.
Okay, thank you, darling. Yeah, I just wrote my comment just in the chat bar as well. I really learned a lot of new information. Of course, a lot of, I think, Black organizations or information is not accessible even to us, as Africans, we did not know. And there's a lot of more that maybe we do not know. So I appreciate all the new informations learned here. Thank you.
So you also had a question in the chat, you said? You placed
No,
a
the
question?
comment. I
comment?
just said
Okay.
thank you. Yeah.
Thank you, Deka.
Yeah.
You're welcome.
Well, I
Also,
think it's time to end the. Paula, did
I
you
guess,
have something to say?
I guess no
Yeah,
question. Okay.
sorry, I was just going to say thank you as well. And yes, the same as others have iterated. It was very informative because, you know, we know of the association. However, I didn't realize just how involved they are, and it's great information to bring back to the community. Yeah, so it's like since COVID, I think people were just becoming more aware during the pandemic. So to know that it's been around all this time, it's like, yeah, it's interesting. We need to know these things for sure. Yeah, and then I also want to know about the training. You're saying that there's 3 components of this training. So today and then Thursday, but then I have other papers that I've printed off because I'm old school, but it's about the survey. So for the specific survey training, like when is that coming up?
We'll-
Or how do I get involved in that?
We will let you know, the
Okay.
person who does that. We have to get in contact with him. And so there's an administration of the survey, there's ABSW and HAAC, but you just, the session that you're just in now. There is background information regarding COVID that the public health put together for us. There is a session on Thursday with the United African Canadian Women's Association to speak about the services and programs that they provide. That will be on this Thursday. For the community facilitators who have done all that training, then there's just going to be an online session regarding for people who are going to use the online survey.
Okay.
Because the survey will be hard copy and it will be online. And so after you complete the training sessions, there will be an information session on just the online survey and those pieces and about
Gift card.
gift cards and submission of hours. How
Thank
you
you.
submit the hours, because the hours go to Dalhousie.
Yes.
And if you have received your service agreement and haven't
Yes.
sent it back, please send it back.
Yes.
If you didn't receive a service agreement, please let me know and I'll make sure that you get a service agreement.
Okay. Yeah, those things were all received and I just printed them off and plan to forward them to you.
Okay.
Thank
Yeah,
you.
they go back to Meredith.
Oh,
Yeah.
The email
they,
address that sent it to you, I think it's Meredith's email.
Yeah.
okay. Thank you.
Okay.
Well, all right. Well, thank you very, very much for attending. We'll see you on Thursday. And hopefully we'll be getting started very, very soon.
Okay. Bye, everyone.
Bye-bye.
Thank you.
Bye.
Thank you all for all that you do. We really appreciate it. Thank you.
Yes.
you.
Abdukoke and Denise, could you stay on? I don't know where Denise is.
She's here. Well, she's still around somewhere. Praise said,
Yes,
I
I
have
can
not
stay
yet
on.
received. Praise said, I have not yet received the service agreement.
Who said that?
Praise.
No
Praise.
worries. So that's what I'll do then.
Okay, I will contact Meredith to find out. I'll get Meredith. I'm pretty sure she sent them out a few weeks ago, but it might have got lost in her span, probably.
I will double check and see, but I haven't seen that.
Yeah, I will
Yeah.
email her this afternoon, and she can just send you another service agreement.
All right. Thank
All right.
you.
Thank you. Have a wonderful day.
You too. Bye-bye.
Bye-bye.
Wow.
Yeah.
How did I do?
Wonderful. You did better than they did. You're
What
on
is your
mute.
mute?
You're on mute.
You're a natural.
Yeah.
You did a fabulous job.
Yeah.
We convinced everybody. Oh, well, I thought you were working for ABSW.
Me
You did good
too.
work. Yeah, you did awesome.
Wow, thank you.
They should make you their ambassador.
Yeah,
Yes.
ambassador.
Oh, Adekoke, you're just awesome at that.
Wow,
I was very impressed.
Yeah.
Nice
wow,
one.
thank you so much.
What is your title again? Gee, I can't.
Communications and media coordinator. What is your title, Denise? You don't know it.
Hold on just a minute. I got it down. I am the, hold on. Community Engagement Coordinator for North Preston.
No, not for North Preston. It's the community engagement coordinator.
Period. No
For
North
Period.
Preston.
project.
Just keep North Preston out of it.
Yeah.
Yep.
Okay, so there, I got it. I just forget to say it. Shut up. I just revert back when I have to verbalize it.
Well,
No,
we
I'm making
had,
Darlene pull her hair out. Oh.
no, I was just on the cell phone talking to someone, texting them. They said they were coming to the meeting and didn't show up. And that's why I find very, very frustrating.
Yeah, no,
And then,
there's no need for that.
and then she sent me, and
No
then she
need
sent
for
me a
that.
text saying that having trouble, can you send link? Add me on Meet so that we can video chat. Use this. I don't know what she's talking about. Like, I have no idea what she's talking about. So I have to talk to her again. But that's the way it's been going. It's just been a friggin' headache for some people. So I'm gonna, I think I need to share first. So we have this. And so we're definitely going to have to add another column in for the United African Canadian Women's Association. No, so Gina has done this. So Aldecoke, since this is yours, how do you want to use your file?
You can click, no, because it's shared, so it's online. We both are, if you go to enable editing, enable,
Where is it?
yeah, that, yeah, so you'll be able to edit. So it's just to click, when you click, it has it down, you don't have to type, so you just,
Okay. Okay.
so it has like a down, I did it like a drop down menu.
Oh, okay. I see what you mean. I'm so
Mhm.
used to doing that. Okay.
So for AWS, so that's arrow by the side. Yeah.
No, it's
No,
not.
no. Can you see the drop down arrow by try and go to by the side, right hand side?
Right here.
Yes. Yeah.
Chantel was there.
Chantel, yeah. There you go.
Tony.
Yeah.
Grace.
Yeah.
No, that's the wrong one.
That was Victoria.
Grace is here. Why is it doing that? That's praise.
Becca.
Yeah, Decca.
Yes.
That's it.
That's it?
Yeah, that's it.
Okay, because there were 7 people. I got Gina, I got Chantel, I got
Well,
Tony.
we've not added the new person, Paula.
Okay, so she has to be.
She's
people,
not on the
Paula.
list yet.
She's not on the list yet because that's a new
She's
one.
not on the list yet.
Mhm.
Paula Black Moore. And she did this one.
It won't have the drop down yet.
Okay, and then there's
So unless you
Paula
manually
Blackmore,
input it.
Pamela, her last name is P. Appling. So you just got to add those drop-down boxes for those two.
Unless you want to do it manually, right? You can do it manually now, though. We just write no. So we can manually type it in.
Okay, and I'll keep it consistent. Okay, so we got those two in. So we got
no.
7, but actually no, because those two people. So we got 5 out of 13. Because I'm not going to count Paula and Pamela. I forgot an E for Pamela.
Because Gina now has made it all. Gina has all now. So
Yeah.
we can turn that into green. That will help.
Okay, Pamela. Gina. And I don't know if I want to turn it into green. No, I'll leave that there for now. But they still have the United African Canadian Women's Association. That's going to be on this Thursday. So if Gina does that on Thursday, and the other people who have already done the other 3, then they're ready to go next week.
So that means if any one of them misses the Thursday one, that's any of these 5, we're saying they can't start on Monday. Is that what we're saying?
I think so, because then if I don't treat all the groups the same, there'll probably be backlash. Like if we're requiring them to take ABSW and HAAC, and it's okay if they miss United African Canadian Women's Association, I mean, then there's going to be backlash about that. And that's going to be on Thursday. Now, Adekoke, how do I send a text to you from her? Because I don't know what she's referring to when she says, this is Bonita Miller. It says, add me on Meet so that we can video chat. See this link. And it's application Google. And I don't
She
know
wants to do Google Meet. That's a Google Meet. So Google Meet is like Teams. It's just a Google version of it. So she obviously wants to chat with you through Google Meet.
So does that mean she wants all the invites sent through Google Meet? Like, I understand how, like, so when you send out the invites, do you use a different?
No, it's true. Our meeting is through what's it called? Teams.
Microsoft, yeah.
Yes. So I'm not sure that she wants to have a conversation with you, or she wants, because she's asked. Did she send you a link? Was there a link with that message?
Yes. On
So
my
I guess she
cell
wants.
phone.
Yes, so there's a link, right?
Yes.
So I guess she wants to have a video chat with you.
A private one.
Yes, on Google
Okay.
Meet. So
Okay.
that's a Google Meet. That's a Google Meet conversation. She's sending you a Google Meet to have a conversation with you. So, Brandon, please, can we first of all save this so that it's saved with the changes?
Okay, yes, we'll
we
save
haven't
it.
done that yet.
Thank you for reminding me. We can't save tracking because the file is read only.
Oh, yeah, read only. Wow.
Yeah, you did that, Adekoke. You read that only. So none of these changes will be saved.
Yep. So let's try and see if we click share. Let's see if I can your right hand side. Let's click share. The share app. Yeah. Let's save to cloud. Yes, let's just save to you save to your OneDrive. So you can
I always save it to my desktop.
Well, OneDrive means you'll be able to access it any and everywhere. But anyway. You can save it to your desktop, and you can also still save it to OneDrive. To your OneDrive, so you have it at least.
Is it saved?
It's not yet saved. OneDrive.
Now it is.
Yeah, yeah.
Yeah. So I need you to share this. How do we do so we don't have to?
Invite people. That would I would do.
Okay. Yeah. Are you okay?
Okay, and why is
I think it's Alan first. I think I saw him. I don't know. Try Alan.
it should both come up. And it's probably down here because it seems to be a law of balance. Crystal, Dr.
Then
Faye.
comma, Alan, comma, then D. Should bring it. Space, then D. Then after the comma, there has to be a space, then D.
No.
So
Why aren't you coming up? Strange.
depends on how it's saved there.
Yeah, like it's not coming up, Denise. Well, we'll have to get it to you. Okay. Come on. I'm trying to delete it now so I can just send it to you, Addict, okay? How come I can't? What happened? It's like frozen.
Maybe you should cancel, then try and just share again, maybe.
Here.
But you haven't saved.
Okay, the share disappeared too.
So let's try and use this. Let's go to file. We should be able to find another file. Share. Yeah. Share with people. Share with people. Yeah, so we'll come back there. So you can remove it now. Yeah.
Okay, I'll send it to you and I'll hit share again.
Yeah.
And so you should have it, and then we'll have to
Yeah.
send a copy to Denise. And for this meeting on Thursday, where Daisy wants it in Zoom, and I know Adikoke from that is a maximum of 40 minutes.
Unless she wants to create the link. Maybe she might have, if she's so keen on Zoom, maybe she might have premium or the paid version.
I
Because if
don't
not,
know.
from my experience with even today, when you think it's going to be 30 minutes, we don't start on time. So we're going to burn about 7 to 10 minutes, at least from using today's experience. And by the time we'll have less than 30, then if not, everybody's going to be knocked off.
What I'm
Unless
going to
okay.
What I'm going to do is I'm going to call her and ask if there's any way possible she can do Teams. I know she had mentioned that the last time we met with her in the association, she ended up sending out the Zoom link because she said she had problems with Teams and all that stuff. And I want to, because we need to get that invite out if we can today, so that people can put it in their schedule. And so I will call her and then I'll let you know, Adikoke.
I'm looking at the file, sorry, that you sent. Let me just share my screen. Because it's saying that you've locked the file. I'm just trying to figure out.
Oh my God.
I have it, but I have it in reading mode, so I can't do anything to it. So just give me a second. Let me share my screen. Sorry about that. You want me to quickly share my screen?
Yes.
Okay, so this is what it's showing me. So I'm trying to move
Someone
it from.
has this workbook locked. And
I
how
don't
did
know.
I lock the file? Oh my goodness. I have no idea. I have no idea. So is that your one?
Honestly, I think this is one we just did. So this is, yes,
Gina, but
I'm
this
able
is
to edit. Yes, so let me confirm I can edit now because I tried to. I can't. Everything is grayed out.
yeah. How about you can turn off the recording, Denise?
What's that?
Well, I'm the one recording, so sorry, I should have turned it off. I forgot. Where's the recording again? Okay. Stop recording. Where are you?